Speaking English because I'm raised in Canada. I am Serbian and born here in Europe. My mother's German. I had a pretty tough childhood. And at one point in my life, drugs were a way of dealing with the pain. So first it was, this is great, nothing hurts. And as you can expect, within time, it became an obsession, it became addiction, it became a crutch, it became the only way in my mind at the time. So I battled back and forth. I had 1 year clean, I fell again. I had 7 years clean before coming here today, or 2 weeks ago. And I saw, it wasn't that I was how I once was as far as addiction is concerned or intensity, but it was leading to that, and I decided to take some action. My wife actually found this clinic, and I read a little bit about it, and the suggestions and program made sense, and they seemed something worth trying, so I did. I'm at the end now. I've received these, what they call blockers. Those are something that are there, in my opinion, just in case. But the real help that I received was all before that. So, first of all, I found that the people in the facility really made me feel like they were here for me. From the cleaning lady to the doctor. When the cleaning lady came through and I said, let me move the, no, not that I do anything. I really felt like I was the first priority. I think that's important for someone who, because most of us are doing this for some emotional reason, and so they were fragile, and we might quit very easily or be discouraged or frustrated. I know that I was leading up to this very nervous, agitated, yelling, this, not myself. So this support is key. And I found it here, and it was great, really. When I first came, there was a little bit of a friction, misunderstanding, and it was a bad start. But by the next day, I felt like I was at a resort when it comes to the treatment and the people that were helping me. So several programs are in place there. The one that I found, the two things that helped me the most and that I can praise the most and give all the credit to, Ibogaine was an experience that was probably one of the toughest experiences of my life. Those 24 hours, as far as any 24-hour period goes before, I don't think anything was as hard. Even if I imagine some terrible scenarios, I would rather do those. However, and the next day, if you asked me how was Ibogaine, I would have said horrible. I was in a fog, nothing was clear, and it was just a torture. But came the second day after, and I put my feet on the ground in the bed in the morning. I saw that my feet are moving, that I have a jump in my step again, the fog is gone. And then it began to slowly make sense. All these symbols I saw. The key part was that the suggestions during the time, it was like an LSD trip, but with control. They say start from when you're young, and they work you all the way up until the first time you try drugs, and to the present moment, and then even to think about your future. So depending on each person and what kind of upbringing and memories they have, this will decide how horrible. Mine was very, as was my childhood. However, weights that I've been carrying in my subconscious, or I've been pushing under the rug, or avoiding, or that have been causing anxiety for years. When I say years, I can say 25 years, 30 years. Literally, I was able to put behind me, to forgive those, myself, circumstances, to accept them within a matter of days. And the next 2-3 days, I liken it to you build a house and you get to the part when you're supposed to put the roof on and you say, geez, it's not right. And you take all the bricks back down again and you say, I'm going to reassemble them. And then you say, now the house is right. The roof, I believe, comes with you once you leave here, because you have to continue to understand that you still have to motivate yourself, discipline yourself, grow with respect to the emotional aspect, because you've been damaging yourself and your emotions for years. You can't expect these people in 2 weeks to resolve all that. But they show you how to. And they give you the confidence and enough pride in yourself to do so. And that's the key. So that the roof you're going to build in the next year after here, in my opinion. Also the psychologist. I actually had the experience of dealing with three different psychologists before I met my actual psychologist, because I came over a weekend holiday thing, so each day it was a different girl. But I found them very easy to talk to, and that's really the point. The point is that they, a lot of things you won't open up about, you won't trust to talk about, so you either go through denial or refusal, or you just don't have the right scenario or person. And I find that the psychologist here really, I found that not only did I open up, I didn't shut up. I was offering information they weren't asking, but it's therapeutic, and it really was a benefit. Those are the two things that I can say absolutely 100% help me, and they are 95% of whatever I may have achieved here. And believe me, my smile is back, I sound different, I talk different, I think different, I sit stiller. There's no anxiety, no nervousness, I don't feel guilty. I look in the mirror and I built myself back up physically, I'm that type of person, but I like also who I see, not just what I see. It's been a long time since I felt that way, and in a very short period it happened. So I have nothing but praise for the program, and I think that anyone that does it can find a solution here. It may not be the same as mine. Somebody might find there are other therapies like aversion and the dropping of the blood sugar. Someone may find those are more helpful. But the point is that they'll listen to you if you just speak to them in a normal, honest way, and that's the key word, honest. They will adjust the therapy that is helping you the most, because that's, of course, the goal here. They want you to be helped so they can help the next person. And I mean, that's what they're here for. That's their goal. They're not here to say, okay, these are 21 steps, let's get them done and get you out so the next guy can come in. Because the next guy might not come, having heard that you got rushed through it and didn't solve anything for you. So success is the only way to perpetuate this whole hospital, and I think that they're on the right track here. I don't know really anything else I can add, but I've seen every type of person here, the kind that they picked up off the street, to someone like myself, who I'm well-educated, university educated, I own a company, I have many workers. I was a functioning addict for all that time. I did all those things while at the same time having a cocaine problem. And then you have the person who knows no other life but the drug life and the street life. And I'm seeing both types of people being helped here. So that, I think it's safe to say, if you have a drug problem, this place is worth coming to. And I have nothing but good things to say, really. Because even what I didn't like and I don't have anything good to say about, it wasn't forced upon me. On the contrary, it was taken into consideration and the treatment was adapted. So I don't know what more one can ask for. Providing the will, this place can help you.
We kill desire to use drugs. Patients lose interest to drugs. He forgets about them. Yes, he lives normally from day to day without thinking about drugs. And this is a key moment, of successful treatment.